My name is Connie Liu, and I live in Gallup, New Mexico. I'm an OBGYN, and I work in this rural community that is largely Native American. Rural America really needs to have a voice in this conversation because I think that the people that live here and our community is going to be really affected by many of the changes that are happening. I am very concerned about the proposed cuts to Medicaid. I do think that if we have cuts to Medicaid, it's going to really seriously impact our ability to provide care here. Rural healthcare is already pretty tenuous. We have a hospital here that has been slowly recovering from financial devastation, particularly during COVID, and I worry that cuts to Medicaid are really going to affect that hospital. I also think it's important for people to know that the federal facilities, federal healthcare facilities like the Indian Health Service and the Veterans Administration really do rely on Medicaid as well. So cuts to Medicaid would also devastate many of these organizations that really support people in our community. Over 50% of people who are in this community use Medicaid as their form of primary insurance. And if they lose that insurance, then they will no longer be able to seek care. They will be saddled with really heavy hospital bills. And more than that, our hospitals will no longer have an income and be able to provide services to all the community. So it's not just going to affect people who rely on Medicaid as insurance, it's going to affect everybody because all of our services are going to be affected. To me, I think healthcare is apolitical. People who live in this community have a right to healthcare. They have a right to access these things not because they somehow have earned the right, but because they exist. This is really the first time that I am watching an administration, and I don't believe that we are seeing America first. We're seeing corporations first. We're seeing rich people first. So I think that it's time to put America first, and particularly rural America.